everyone, welcome to Research MD. This is Dr. Pramil. I work as a program director, internal medicine residency, and a chief medical officer, associate professor of medicine. So we're going to continue our lectures to teach you about the most important topic in the in-service training examination. Very, very important. A lot of people don't realize the importance of in-service training examination score, but please, anytime when you're in the residency, especially internal medicine, in-service training exam score is the most important thing you can do. Always. If anyone tell you that's not important, who cares? Don't believe them. Okay, so let's go into our topic today. We did a lot of topics on nephrology. We're going to continue that. Today's our topic is the type of renal stones. The word is urolithiasis. Okay, so let's start with the stem and a question. 35-year-old man, sudden onset severe right-sided flank pain, gross hematuria, non-contrast CT, 4 millimeter stone. Okay, so in the distal ureter, consume high oxalate diet, spinach, nuts, and recently started calcium supplement. 24-hour urine collection shows hypercalciuria and hyperoxaluria. What type of stone is most likely? The answer is calcium oxalate. Again, most of the time, if you know the most common stone, what is the most common kidney stone in the United States? Calcium oxalate. A lot of times, if you pick calcium, you're right. But again, in this answer is calcium oxalate because, this is the most common type associated with hypercalciuria and hyperoxaluria. The patient has taken oxalate-rich food and calcium supplement contributed it. Okay. All right. Next question. 62-year-old came in, urinary tract infection. Alkaline urine, flank pain, Proteus and staghorn calculus in the right kidney. Then you have to know the Struve stone is the answer. Okay, you got 4 options. Again, this everybody knows this. I think if you have taken USMLE, you know there's a UTI, Proteus, and the staghorn calculi. You know that. Okay, so let's look at the description. Struve stones. Again, chronic urinary tract infection is going to be there. Now, remember, don't always kind of think it's Proteus always, okay? Now, in the recent question, it can also be in Pseudomonas and Klebsiella. So sometimes they write in Klebsiella to confuse you. So remember, a Struve stone in Klebsiella, remember 3 organisms, Pseudomonas and Proteus and Klebsiella. Recurrent UTI, neurogenic bladder, indwelling catheter, okay? And the next question is about a 58-year-old man with a gout and urine pH is 5.0, radiolucent stones. Remember, we said that if it's radiolucent, there's no question, uric acid. And then in this patient, they're talking about gout, uric acid is going to be elevated. Acidic urine, gout, radiolucency. 3 things you need to know, okay? The next one, again, we're talking about uric acid, hyperuricemia, dehydration, high protein diet. When uric acid, the question usually about this patient is on malignancy, chemotherapy, tumor lysis syndrome, and they can put all this. And you need to know the treatment, like alkalinization of urine and allopurinol, the treatment also. Okay, next question, 25-year-old man with a long history of kidney stones, and he got hexagonal cyst since childhood. Remember, something genetic if something happening on the childhood. So what is it? Cystine stone is the answer in this, okay? So it's a genetic disorder, cystinuria, hexagonal crystal. Like anytime somebody give you like a question about a child and happening since childhood, think about the genetic connection. Again, this is already, we already said cystine stone is radiopaque, and you got the hexagonal shaped crystal, socio-condition, autosomal recessive, cystinuria. How do you treat it? Low sodium diet, alkalinization, chelating agents, and you have to know how to treat all that, okay? Remember the stones. Now, next question, you got a 45-year-old obese man, colicky, diabetes, diarrhea, you got a pH of 5.3 and multiple radiolucent. What did I say about radiolucent? Uric acid stone, right? You have to know the acidic urine more common in metabolic syndrome, diabetes, chronic diarrhea, which promote acidosis, and radiolucent uric acid. You need to put that in your mind, like, radiolucency, uric acid. Okay, so the next question is about a 50-year-old hospitalized, fever, chills, branch stone through the pelvis, alkaline urine, and you got Klebsiella. What is it? You got Struve, okay? People don't wait for your Proteus to come in because, your mind is always, it's not Proteus, how can it be Struve stone? No, Struve, remember, we talk about Pseudomonas, we talk about Klebsiella, we talk about Proteus. So you need to take the Proteus out of your mind when you study for this IT exam, okay? Now, 29-year-old came with a recurrent kidney stone, low calcium and high oxalate. The stones, to avoid further stones, but the stones persist, stone analysis or calcium oxalate. So what is the likely reason for this recurrent stone? Okay, a low calcium intake is the answer. Okay, so what happens is when you take low dietary calcium, it increases the intestinal oxalate absorption, so make the calcium oxalate stone formation more. Okay, so adequate dietary calcium is the key word to prevent all of that. Okay, so if you like our channel, please like, share, and subscribe to the others. We would like to make more videos like that to teach you everything about how to score very well in the in-service training exam. Thank you so much. God bless.